Hi, this is Dr. Sri Nagesh, a qualified plastic surgeon from Ojas Aesthetic, Hyderabad. Today we shall be talking about breast augmentation and breastfeeding, addressing the common concerns. Breast augmentation is a procedure that many women consider at various stages of life, including those before having children or after having children. If you are planning to breastfeed your child in future or are currently breastfeeding a child, you may be having some concerns about whether the implants could impact your lactation and your baby's health. So this is what you need to know. In most cases, in fact, I would say in all cases, breast augmentation does not interfere with a woman's ability to breastfeed. However, certain factors need to be considered. One is the incision location. An inframammary incision, that is uh, an incision made under the breast in the breast fold, usually does not impact the milk ducts or glands, making it one of the safest options for breastfeeding. Periareolar or an incision made around the nipple, this particular incision may carry a higher risk for damaging the milk ducts or nerves involved in lactation. So this, when this incision is made, then it can affect, there is a possibility to affect breastfeeding. The third is a transaxillary approach, wherein you make an incision in the armpit. So this technique also avoids breast tissue uh, and thereby reducing the risk for interference with milk production. So implant placement is another uh, thing to be concerned and considered. The subglandular placement, that is above the muscle, these when these implants when placed directly under the behind the breast tissue, there is a potential uh, risk of compressing the milk ducts to a certain extent. Whereas submuscular or placement of the implant under the muscle, it does not have any effect on the milk ducts and glands, so making it more favorable for breastfeeding. So, what is the now? What is the extent of glandular impact? Again, depends on the integrity of the milk producing tissues and ducts and the volume of the breast that is there before the surgery is considered. So, most of the surgeons look into all these considerations and suggest the placement of the uh, implant as well as the volume of the implant that needs to be inserted. So usually, women, uh, if they experience a reduced milk supply, can have a reduced milk supply only if the milk ducts or nerves were damaged during the surgery, or if there is a significant pressure from the implants placed on the milk glands. So usually, uh, research has indicated that breastfeeding with saline or silicone implants is generally safe and has no significant differences in breast milk composition between women with implant and those without. And silicone implants are made of with cohesive gel, and this reduces the risk of leakage into the breast milk, and so there usually is generally not a big problem. So, what are the successful tips for breastfeeding with implants? You can consult a lactation specialist, uh, a professional who can help you with tailored advice and support, particularly if milk supply is a concern. You can focus on breastfeeding position, monitor the milk supply. Some women, generate low volumes of milk. Some generate adequate volumes of milk. So these have to be considered, and frequent nursing and pumping to stimulate production can be considered, or you can also seek medical advice in case you think about and have any issues. So if you have any other queries, you can always feel free to contact us at 95151 or visit us at our clinic, Ojas Aesthetic, Madhapur, Hyderabad. Thank you.